Hey guys, be sure to press like and subscribe. Today I want to talk a little bit about doctors in the Philippines and having regular appointments. Most of us that come over here as expats are retired and we have health issues. And a lot of the guys that come over here, they don't stay up on top of those health issues. A lot of them let their diabetes get out of control. And I've seen this firsthand too. And so have many other expats. Heart conditions get out of control. We don't get regular checkups. And one of the things I want to touch on here in the Philippines is, you can get a doctor's visit, and some people will say, well, you get what you pay for, and sometimes you do. But in the Philippines, as far as doctors are concerned, doctors are very reasonable, and you can find a good doctor over here if you search around, from anywhere from $6 to $12 usually, and usually it's below the $10 mark or the 500 peso mark, okay? It's very reasonable to get a checkup every month, to go in and see a doctor and just get checked. And, you make part of that your budget. And it's one of the reasons why I go a little bit overboard and say, $2,000 to $3,000 is the sweet spot, the safe spot, things like that. I'm not going to really get into that too much, but, it is one of the things over here that a lot of people don't do, okay? A lot of the expats that are on the tinier budgets leave out safety, health safety. They leave out insurance safety, health insurance safety, life insurance safety, lawsuit safety, emergency safety. Something happens to their wife or child or, maybe their girlfriend's son or daughter. You're kind of responsible for those things. And it's happened to me before where my girlfriend's daughter got sick and we had healthcare costs, and some of the family picked up some of it, but I had to pick up some of it too. And so will you, A lot of guys say, well, I'll pick a girlfriend with no kids or something like that. It's kind of hard over here. A lot of the people over here already have kids. Is it possible? Yeah. If you're going to go for a younger girl. But most older guys, I wouldn't recommend going with a younger girl because a lot of times it's about money, and let's be realistic here. Not in all cases, once you get past like 35, I would say, things change a little bit and the girl's more willing to go with an older guy because they're probably looking to settle down or what have you. But to touch back on this healthcare issue again, when you come over here, the first thing you want to do when you get here is get a doctor, whether it's at a medical clinic, one of the small walk-in medical clinics, and go in there and see if you like the doctor there. If you don't like the doctor there, go to another place, and see if you like the doctor there, because you want to find a doctor that's going to work for you. That's really going to work for you. And if that doctor doesn't work for you, then you need to find a different one. And it's good to have one doctor possibly near home, and it's good to have a doctor at one of the local university hospitals or one of the local hospitals that's halfway decent. Notice I said halfway decent. The hospitals over here are all different levels, okay? They have hospitals for wealthier people, they have hospitals for poor people. They're called public hospitals and they're free to the poor, but they call them the places where you go to die, okay? And, they, even if you go to a regular hospital like De La Salle University Hospital, they have a place they have like for poor people too. And I would imagine you could probably go there if you wanted to, but I wouldn't recommend it, and the lines are kind of long. But, you do want to go get a decent doctor at a university hospital, and possibly go in there every 3 months or 6 months or whatever, just to get a regular checkup. Talk to them, tell them what's going on, have them check your blood pressure, all that good stuff. And, that way there you can know that you're fairly healthy, or you need to get some medications for blood pressure or what have you, diabetes, all that stuff. The other thing is, get checked regularly by one of those medical clinics also, maybe once every month or two, depending on how healthy you are, because some guys just aren't healthy. They're just not there, and those are the people that need to be checked up more. You know, and I worry about these guys. When I see them coming over here, I see them walking around, they don't look healthy, they look sick, and usually they don't live that long over here because things get worse. They just don't look out for their health. And some of them just don't care. You know, they've lost their sense of direction in life. They've just given up and figured, you know, this is it. You know, and I'm not sure what's going on with them. I think some of them, and this is why we pound that budget thing into your heads. You know, that some of them, their income that they were getting from before is just not enough anymore, and they've kind of given up. Whereas if they went home, they could probably get some help from welfare, probably some. If they went to like a more liberal state, they could probably get some help, and it would be probably worth it for them to think about that, because they could get proper health care. They could, you know, if they went back home. And some of these guys are disabled vets, some of them are veterans. They could go back home and live in a veteran's home and probably live fairly well and happy too. You know, I realize it's tough for them to leave their new home over here because they plan on living here the rest of their lives, but sometimes you got to tap out. You know, and we've talked about that a little bit too in the past, you know, but guys, stay healthy, you know, please. You know, I implore you to go see a doctor, or go to a university hospital and make an appointment with a medical doctor there, or whatever type of doctor you need, and pay to get that health care. You know, it's worth it. Stay healthy, guys. A lot of you guys, you know, you come over here and you let things go. Put that in your budget if you come over here for your health care. Get insurance. Get life insurance. Take care of yourselves. Don't listen to these other guys telling you can live over here on $600 a month. They're not including health care. They're not including hospital visits, checkups, and prescriptions and stuff like that. You know, I mean, I can't tell you guys what to do. I'm not your teacher, you know, but I can try to help you guys. Anyway, guys, God bless, and thanks for listening, guys.